Good evening, everyone, and welcome to Mandel's PharmAssist MedTeach program. Our speaker today is Kaitlyn Endicott. Thank you very much, Kaitlyn, for making time for us tonight. And take it away. The floor is yours.
Great. Thanks, Craig. Good evening, everyone. I hope everyone had a great holiday weekend. Like Craig said, my name is Kaitlyn Endicott. I am an IVF nurse in the Northern Virginia area. Thank you for joining us for the PharmAssist MedTeach program brought to you by Mandel's Clinical Pharmacy. We appreciate all of you tuning in tonight. We hope that this program helps you to feel at ease with your fertility medications, gives you a step-by-step resource that you can pull up when starting injections and the different medications that you will encounter in your fertility journey. Hopefully, too, we'll tackle some frequently asked questions and maybe even some troubleshooting. So tonight we have 3 products that we will be reviewing. The first one is Ovidrel, followed by Progesterone In Oil, and then we will finish with the Synera patch. Just a reminder, as we move along, we will have time for Q&A sessions. So the format will be a video followed by a small amount of time for some Q&A, and then we'll move on to the next product and so on and so forth. Reminder on the questions as well that please keep them focused on the actual product themselves. Unfortunately, I can't answer any questions that are personalized to your treatment plan or dosage. Those would be questions that we would want you to direct to your healthcare provider. This program is designed to hopefully take away some of those nerves, and I promise after you guys do a couple of these injections, you'll be pros and you will look back and wonder why you were ever nervous in the first place. So like I said, the first injection that we will review is Ovidrel. This is a subcutaneous injection that is used as a trigger shot. So I think we are ready for that video, and you are, Craig. Now we're going to review how to do an Ovidrel subcutaneous trigger shot. Now the shot will come in a box that looks like this. It's all pre-filled, ready to go for you. No mixing, the needle's ready. So this is generally just how to do a subcutaneous shot. So you'll need your supplies, you'll need your injection, so you can see it here. You also need your alcohol prep pad, and that's it. So since the shot is ready to go for you, really what you need to do is select your site for injection. Now, subcutaneous injections can be done in multiple places. I would confirm with your healthcare provider where they want you to inject. Generally, I recommend either the abdomen or the thigh tissue. Really anywhere that you can pinch an inch of skin is fair game. I think most of my patients end up doing the abdomen, but it's up to you. So once you have chosen your site, you will open your alcohol prep pad, clean the area, let the alcohol dry, and you will take your injection, take the cap off, and you will see the needle there. Now, if there's a little bit of air in there, you can always press it up to get rid of it. Otherwise, it's pretty much pre-filled for you. Then you will pinch an inch of skin, so that area that you prepped, pinch that inch in fast, 90 degrees like a dart. Press the plunger. Hold it for a few seconds, then remove. At this point, this can go straight into your sharps container. No need to recap it to risk sticking yourself. And you've completed your Ovidrel trigger injection. So that was the Ovidrel trigger shot. That one is pretty straightforward. It's nice you don't have to do any mixing. It's pre-filled, ready to go. So if anyone has any questions about Ovidrel, we can start those now.
Great, Kaitlyn. So we did get one question that came in that says, I received my Ovidrel last Thursday, but I unfortunately did not refrigerate it before leaving for the weekend. Do I need a replacement?
So it depends on when your plan is to take the trigger shot. So if the Ovidrel is at room temperature, it is good for 30 days. So if you are actively cycling and you will be taking it within 30 days of when it hit room temperature, then it is perfectly fine to use. If it will be more than 30 days, you should get a new one. I typically tell my patients, as soon as you get it, put it in the refrigerator. You know that it will be good until the expiration date on the box, just to be safe.
Perfect. Thank you very much. All right. Sounds good. So another question that just came in that said, I know you specifically mentioned that you could give the shot anywhere, but just to be sure, can I inject it into my arm? I'm not a big fan of injecting in the belly.
Yes, you can. So the 3 areas that I typically recommend is, like I said in the video, the belly, and that's probably the most popular site that my patients use. The tops of the thighs are okay. You can also do the arm. If you're doing it in the arm, I would suggest going kind of around the back side of the arm where you can pinch a little bit more of the skin up. Anywhere that you can pinch an inch, just make sure it's that fatty tissue that you're pulling up to the top. And any of that is perfectly fine to inject in the arm.
Great. Thank you very much. All right. And feel free again, anyone, you can put in any questions into either whether you're joining on Facebook or in Zoom. Anyway, it'll get to us and we'll definitely get a chance to answer your questions. Speaking of which, this one just came in. Somebody said, okay, I think there's a bubble in my Ovidrel vial, but I'm not sure. In my Ovidrel, but I'm not sure. Do I have to take it out?
A little bit of air is not going to hurt anything. I know that the movies kind of make any air in a syringe that's being injected seem super scary, especially with subcutaneous injections. You are not putting this into a vein. If there's a lot of air, I would at least press it up. But if there's a small bubbles, they're perfectly fine. You can leave them. They're not going to hurt anything. A lot of my patients just like the peace of mind that all of the air is out. So if you choose to get rid of the bubble that may be in there, you can, and I actually have one here, you can kind of flick the syringe to make it rise to the top, press your plunger up until you see a few bubbles come out of the end. Then you know it's completely primed, but a few bubbles are not going to hurt anything in fatty tissue.
That's great. Perfect. Hopefully we're putting a lot of people at ease right now. It seems like most of the questions are coming in about things people get a little bit nervous about. So it's great that we can calm them down and know this is not as hard as you think. So this one is a little bit more of an overarching, just kind of educational question. So I think maybe you can dive a little bit into this one, but I think there's a little bit of confusion about the name because it says, I hear it's always called the trigger shot, but what do we actually mean by trigger?
Yes. So this is a common question I get from patients, especially patients that are new to treatment. We all get so used to just saying your trigger shot. We call it the trigger shot because it actually triggers ovulation. So throughout a cycle, when the follicles are developing, there are eggs inside the follicles. As they're growing and maturing, the eggs actually stick to the wall of the follicle. And the trigger shot essentially triggers ovulation, meaning that it causes the egg to release from the follicle wall, and then it free floats in the follicle before eventually being released completely from the follicle to then be fertilized.
Great. Thank you for that in-depth explanation. Hopefully that clears up some of that for everybody. We are waiting. We have any other questions? Feel free again to jump in and share them. But in the meantime, I know it takes people some time maybe to process everything and come up with their questions, get them into the chat. So kick it back. Kaitlyn, is there anything else you want to share as we give people a couple more minutes on the Q&A section?
Yeah, this one is one, and it varies from clinic to clinic, but where I work, this is one where those that are a little bit newer to treatment, this might be one of the very first injections that they have to do. So it's nice that it's pre-filled, ready to go for you. It's a good one to do as kind of a confidence boost. Like I said at the beginning, after you do it the first time, you'll look back and it'll be a piece of cake. You'll be a pro after you do it for the first time.
Sounds good. Thank you very much. So we're looking okay on questions right now. So one thing I will just say to people, if you did not get a chance to ask any questions before we move on to the next product, you can always save those at the end. We will give a couple minutes for any last minute questions that people didn't get a chance to chime in on, and we'll give Kaitlyn a chance to answer them at the end. So feel free, Kaitlyn. We can hop on to the next product for now.
Perfect. So the next one is progesterone in oil injections. These are intramuscular injections, oftentimes used with a transfer cycle of an embryo. So I think we are ready when you are, Craig. Now I'm going to show you how to do a progesterone in oil intramuscular injection. First, I recommend collecting all the supplies that you need to do the injection. So first and foremost, of course, you need your progesterone in oil medication. So collect that vial. Next, you will need a syringe and needle. Typically, it's a 3 ml syringe that's used. A lot of times they will come with needles attached onto them. For the sake of this video, my practice uses the 22 gauge needle to inject and an 18 gauge needle to mix. I recommend talking to your provider about what they prefer you do for your treatment. So here I have the 3 ml syringe with a 22 gauge 1.5 inch needle. So then I also have a 1 inch 18 gauge needle to mix. You will also need your alcohol prep pad. So at this point, go ahead and take the cap off of your progesterone in oil. It just snaps off here. You'll see the rubber stopper on top. Then open up your syringe that has the needle attached. It'll peel open like a banana peel. And then you can open up your needle that you'll use to mix. Now, if your provider wants you to use the same needle to mix and administer, you won't need to do this step. So that second needle opens up like a banana peel as well. I recommend avoiding touching the top of this cap here and keeping that sterile. Then if you twist, your other needle will come off. You can set that down to use later. Then this needle will twist on. If you twist to the right, then you can remove the cap. And again, at my practice, we typically have doses of 1 ml. So for the sake of the video, that's what I'm going to use, but I would confirm this with your healthcare provider. So I recommend drawing back to the number that you will use to administer. And what I mean by that is if I'm using 1 ml, I'm drawing back right now 1 ml of air. So you can see my plunger is right at that 1 ml mark. Then you will take your vial and the needle goes right into that rubber stopper. Then push your air in, flip the vial over, pull your needle down slightly to be sure it's in the liquid and pull back, and you'll see the medication pull back into your syringe. And it is oil, so it's a little thicker, so it might take a little bit of help of you pulling down on the syringe. Now, if you have some air, that's okay. You can push back up and start over. That's perfectly fine. So like I said, I'm using 1 ml for this video, so I have 1 ml of the oil here. Take this out. So now I'm ready to administer. I do not recommend administering an intramuscular injection with an 18 gauge needle, which is why I saved my 22 gauge needle here. So this will twist off, put it directly into your sharp spin, no need to recap it. And you'll twist on your needle to inject. So now we are ready. It's time to prep our injection site. For the sake of the video, this is going to be my skin and my muscle. When you're doing it at home, I would confirm with your healthcare provider if they have a preference of a site for intramuscular injections. I typically recommend using the upper outer quadrant of the buttocks, so it's almost like your hip area to do the injection. So once you have chosen your injection site, open your alcohol prep pad, clean the site with alcohol, let it dry completely. Take the cap off of your syringe, And then you're actually going to kind of pull the skin taut, and then you will inject quickly, fast like a dart at 90 degrees. Fast there, all the way to the hub, and then press the oil in. Now it is thick, so it can take a moment to go in. Typically in skin, it's a little quicker than my cube here. Once the injection is in, you take your needle out. There might be a little bit of oil that comes out of the site, and that's okay. You can just wipe it up with some sterile gauze, and then you can recap your needle, put it into your sharps container. You're done. Now, one thing I like to mention with the progesterone in oil, especially because a lot of times when patients are taking this, it's for extended periods of time, weeks on end. So the oil can actually kind of collect if you're not active and moving after you do the injection. So the worst thing you can do is go back to bed, wake up in the morning, do the injection, go back to bed, and let it sit. I recommend massaging the area. You can take like a tennis ball or a lacrosse ball and kind of knead down the area as well. Heat can help disperse the oil as well. Just if you use the heating pad, be very, very careful that you pay attention, only use it for small amounts of time. And then being active, so walking around, going for a walk, things like that can help to disperse the oil into the muscle as well. Okay, so that was the progesterone in oil, a little bit more involved than the Ovidrel, causes some drawing up of medication. But other than that, it's always in fast 90 degrees like a dart. I think we are ready for questions.
Yes. So again, everyone, just remember, you can type them into the chat both in Facebook, or if you're joining us via Zoom, feel free to type in your questions in the Q&A section there as well. One that has come in actually a couple of times, so this seems to be something that a lot of people have heard before. I've been told that these specific injections can be quite painful. Can I use ice or heat or something else to alleviate the pain?
Yes, so this is one that I hear a lot as well, the pain that comes along with these, and a lot of times it's because you're doing them for an extended amount of time. It's not always just a one-time deal like a trigger shot. You can use heat, like I said, afterwards to help the oil kind of disperse into the muscle. Ice, this is one that is, I would say, a personal preference. Generally, I say stay away from it, only because when you think of oil, if you were to put in the refrigerator, it would thicken up and harden a little bit. So if you were to ice the area for long enough that deep into the tissue it became cold, it might cause some discomfort and make it a little bit harder for it to disperse. Now, if you want to use ice for just a minute or two to take off the edge of the initial injection site of the needle going in, that would probably be okay, but I would stay away from completely numbing the entire site with ice prior to doing that. Otherwise, it might kind of linger on throughout the day.
Perfect. Thank you very much. Another question, actually, from last week, our speaker, Karen Hammond, has joined, and she has a question for you, Kaitlyn. Can you take these injections in the arm as well?
Technically, you can do intramuscular injections in the arm, the upper, kind of like where you get like a flu shot. But again, make sure you're really moving that muscle around. I find it's easier to walk around than to move your arm for a while to help that oil disperse. Now, sometimes it's easier if you are doing it yourself that way, but even some patients will do it in their thigh. As well, and that's another option. It's easier if you're doing it yourself and you don't have someone to do it for you. Sometimes doing that hip is a little awkward, turning around. Another thing that we do for the hip type injections at my practices, will kind of draw targets on people. So if you don't mind a Sharpie circle on you, I'm sure your nurse would be happy to draw those for you and take away one step of the process for you, give you a target.
That is a great answer. Thank you very much. And I know that can put a lot of people at ease, knowing some of the things, the knowledge they can bring when they talk to their when they go in to see their healthcare professional as well. So thank you. And thank you again, Karen, for showing support and showing up tonight for Kaitlyn. We appreciate it. We love the camaraderie between the PharmAssist nurses that we have here. So thank you for making your appearance. This question is one we hear quite often. How do I know if I'm inside the muscle with these shots?
So typically, as you noticed in the video, and I have one here, how I emphasize, make sure you are injecting all the way to the hub. So the needle can be a little scary. It's longer than those subcutaneous needles. So if you are going all the way in, it's likely you're in the muscle. Another way to check is once you are in, you can pull back on the syringe to make sure you're not in a blood vessel. This is one of those things that was very popular, and now in nursing schools they aren't teaching as much to pull back. But if you do pull back and you see some blood enter into the syringe, you can just pull the needle out just a little bit and then check to make sure that you're not in there.
Perfect. Thank you. Okay, so let's see. You've got a couple things coming in at once. So let's see. How about this one? Okay, so how do I store this medication?
So this medication should be stored at room temperature, so you can leave it out on the counter. I wouldn't put it in the refrigerator just because that oil can thicken up. It's already kind of thick on its own, so having it at room temperature keeps it as thin as possible and easier for when you're actually injecting it into the tissue, and more comfortable than if it were cold.
All right, sounds good. Let's see. So another question coming out of Facebook right now. So can I just use the 22 gauge needle instead of switching to the 18 gauge needle for a Prog injection?
Yes, so you can use just the 22 gauge needle to draw up and administer. The 18 gauge can sometimes be a little bit easier to actually get the oil out from the vial. That's why we typically recommend switching it off. But if you want to eliminate one step, keep the 22 gauge on and draw out that oil. 18 gauge, some practices will say that you can administer with an 18 gauge. I think it's a little big personally, but that's something that I would confirm with your clinic.
Thank you very much. Okay, so I'm seeing a question that's come through a couple of times. I had these injections with my last cycle and I got huge welts. Is there anything that I can put on to treat the itching? What should I do that can try to help with some of these side effects?
Yes, so this is a common side effect that I hear with the progesterone in oil, and it may not always show up with the very first injection. It can kind of happen over time sometimes. So there's a few things that you can do. One may be, and I would confirm this with your healthcare provider, like a Benadryl or an over-the-counter cream that can help if it's just a local kind of reaction, itching and the welt and the small rash around the injection site. Another thing that I oftentimes recommend if it's unbearable is to go ahead and have call the pharmacy and see if they can mix with a different kind of oil. So you may be sensitive to that oil, and there's many different oils that can be used to mix the medication. So sometimes switching the oil type can help to alleviate some of those symptoms. If you get any of the type of allergic reactions, anaphylactic reactions where it's difficult to breathe, lips or tongue are swelling, those are things that are a clinical emergency that you need to either go directly to an ER or call your provider immediately, as those are signs of an allergic reaction. Like I talked about in the video, that oil can lump up kind of under the skin if it doesn't disperse quickly. So like I said, moving around, massaging the area, a heating pad, those things can really help the oil to disperse quickly and not settle and cause as much discomfort. Now, if you do have those lumps under the skin from the oil buildup, it's helpful to rotate sides every day to give the sides a recovery time. And if you're going to inject on a site that does have one of those kind of lumps under the skin, try to stay at least 1 inch away from it. You don't want to go directly on that same site until it's recovered.
Perfect. Thank you. And again, just so everyone knows, some of these answers that are a little bit more in depth, we are recording all this. Obviously, you can go back and you can check this again on Facebook. You can watch it again via our website or on YouTube. We'll go through all the names of the places you can get it at the end. But just so you don't feel like you're frantically trying to write all this down, you can listen again. So here's one quick question, just changing things up a little bit, moving away from some of the potential side effects, but just in general, people are asking, like, what does this medication actually do during my cycle? What can I expect? Why am I taking this in the first place?
Yes, great question. So this medication is typically used in embryo transfer cycles, and that is because we are taking over the body's production of progesterone until the placenta is able to take over. So in a natural pregnancy, the corpus luteum is the one that produces the progesterone until the placenta can take over. In this case, we are substituting for that, and the placenta typically takes over around 8 to 10 weeks with the progesterone production. So it's likely you'll start weaning off of this around that time, but that's something that your clinic will give you specific instructions as to when to start weaning the progesterone supplementation.
Perfect. Thank you for that explanation.
Mm-hmm.
Appreciate it. Now, one other question that just came in. How do I tell the difference between a normal rash or if it's an actual allergic reaction?
So this is something that it becomes kind of like your tolerance level. So some patients are like, I have kind of a local rash. It's 1 to 2 inches around. It's a little bit itchy, but I can deal with it, or it doesn't bother me too much. So that's something that we might just treat topically. It doesn't seem to be spreading. You aren't having any trouble breathing. Other times it's unbearable, the itching or the rash is so sensitive that clothing rubbing up against it is unbearable. If there's any difficulty breathing, if the rash or hives is traveling throughout the body in other locations, not just the injection site, that's something that I would definitely let your provider know, as it looks like that would be more of a allergic reaction as opposed to a local.
All right, sounds good. So it looks like right now that is all the questions. That's a lot of questions. So I will throw it back to you, Kaitlyn, if you want to give everyone, you have a couple more, you got a minute or so if you want to type in any more questions. And Kaitlyn, if there's anything you want to share as we give them that opportunity.
Yeah. Again, lots of questions, because a lot of times this is the kind of scary shot, from fertility treatment. And a lot of patients are nervous about this one. So a lot of times up till this point, their intramuscular injection, if they've even done one, was a trigger shot or something that wasn't oil-based, and they weren't doing as often. So this one is a little more intensive. I do hope that this video gave you some hints and tips to help alleviate the side effects and some of the discomforts that come with it, as that can really make a difference, especially when you're on this for a sustained amount of time.
Perfect. And actually, this question just came in. It seems maybe related to the last answer you gave about why people are taking this in the first place. Mm-hmm. The question was, I thought that the body made progesterone when you're pregnant. Why does it have to be injected?
So it does. That placenta will eventually make that progesterone. A lot of times, though, in fertility, when we're using the progesterone in oil, before we've gotten up to that point, we are controlling everything. We're doing all supplement, or at least my practice, we do estrogen supplementation. We also do progesterone supplementation. We are kind of overriding everything to make sure that we're getting a really good lining for the transfer to give a good chance for implantation, because that's the goal, right? We want implantation for pregnancy. So we have taken over that natural process. We don't have the corpus luteum there producing that progesterone the same way it would in early pregnancy. Typically the progesterone timing is crucial, and that's why we can't wait for the body to do it on its own in early pregnancy. We have to start that first initial exposure of progesterone. And like I said, once that placenta takes over in 8 to 10 weeks, then this is something that is weaned off. So it's not for the entire duration of pregnancy.
Perfect. Thank you very much. And I think right so far that seems to be we're all caught up. So if you want, we can move on to the next segment.
Perfect. So our next product is the Synera patch. This is a product that can be used to help kind of take the edge off with some of the injections. So we are ready when you are, Craig. Now we will review how to use a Synera patch. The patches will likely come in packages such as this. So I recommend just gathering your supply there and deciding what site you want to use. Now, the patch does need to be applied directly to the site that you plan on doing an injection, and it does need to be applied about 20 to 30 minutes prior to your planned injection. You'll take your patch out of the packaging. This is the top of the patch, so when it's on, this will face outside, and then the sticky part is here, and there is a plastic film over it that you'll need to peel off. So it comes apart like this. And this does need to be applied to skin that is unopened and clean. So if you have residual tenderness or scabs, I wouldn't recommend putting this over that skin. I would find a fresh new site. And then after that, you just apply the patch to the skin. Make sure it's flush against the skin. You do want to make sure to not cover up this outside part where it has these little vented holes. That's how the patch begins to do its magic. So when it's on, it'll actually feel kind of warm, and that means it's just increasing that blood flow in order to kind of absorb the medication even quicker. Once you have it on for 20 to 30 minutes, you can peel the patch off and then prep the site for your injection. And that's how you use the Synera patch. The Synera patch, one thing I forgot to mention with it is when you pull the patch apart here, the medication is right in here. So be careful not to press your finger into the medication. Just keep it around the outside. And then when you're done, an easy way to get rid of it is just to press it against the packaging that it came into so that the medication is kind of trapped in there and it doesn't expose anyone else. And then you can just throw it away in a normal garbage can.
Perfect. Okay, so a couple questions that just came in. So I guess in terms of some of the timing related questions I see here, if I forget and put it on for only about 5 to 10 minutes so as not to miss my injection time, will it still work if I don't leave it on for the full 30 minutes?
So it will likely help kind of take the edge off. It will reach its maximum effect in the recommended 20 to 30 minutes. So I recommend it's more important to get your injection timed out as opposed to being late for it, as a lot of injections in fertility are crucial based on their timing. So if you only have 5 to 10 minutes, you can certainly put it on. It may help to take off the edge, but it may not completely be as numb as previous times that maybe you had it on for 20 to 30 minutes prior to injection.
Sounds good. So probably just try to remember is what it sounds
Yeah.
like you're
Do your
saying if
best.
you're
Set an
worried
alarm
about
on your
it.
phone.
Right. There you go. Well, it's funny that actually, as we're saying this, the opposite came in, that somebody said, is there any danger in leaving the patch on too long? Can something happen? Will it have a negative impact?
Yeah, so the manufacturer recommends 20 to 30 minutes. If you leave it on longer, you can take in too much of the medication, so we don't want that. Trust the patch. It will work in the 20 to 30 minutes. You don't need to leave it on for an extended amount of time. It will do its job in the allotted time that they suggest.
Great. Thank you for clearing that up. And one more that came in. Can I use these for any injection, or is it only to be used for an intramuscular injection?
No, you can use it for any injection, whatever makes the injections easier for you. So subcutaneous, intramuscular. I also will oftentimes tell my patients to plan it out with the phlebotomist at your clinic. So a lot of times when you're going through treatment, right, you're coming in a lot for blood draws. So that might be something that you want to utilize the patch for as well. So I usually tell them to talk with the phlebotomist about different sites and rotating those sites and where they recommend maybe applying the patch before their appointment, so that it is taken hold, prior to the blood draw. And if patients are undergoing a procedure that might require an IV, this is another good thing to use for that. So that's another thing that I always recommend is coordinating, potential sites for that and where you could put on the patch maybe a little bit before your procedure so that the area is numbed.
Sounds good. And one coming in just says, are there any sites that you would not recommend utilizing the Synera patch for?
I would not, like I said, any sites that are open or have scabbing, anywhere that is maybe tender from previous injections, let that area recover. Again, keep in mind that this does need to be used in those sites that are okayed for your type of injection, right? So whether it's subcutaneous and you're doing it in the belly, the arm, the thigh tissue, or intramuscular injections in the upper outer quadrant of the buttock, the thigh, those are, you have to make sure that you're applying it to those places still. So keep that in mind when you're rotating the sites.
All right. And so we're good right now on questions so far. Again, this one's probably a little bit simpler for people, so not as many questions may come in for this one, but we will, of course, give you some time. If you are still thinking of your question, I'll throw it back over to you, Kaitlyn, to give people a minute to maybe type in anything, finish up typing any questions. Again, whether you're in Zoom or in the Facebook Live chat, you can reach us either way. And we'll give a chance for you can, at this point in time, if you have any questions about the previous two, Ovidrel and Progesterone In Oil as well, feel free to add those in right now.
Perfect. So yes, don't be afraid, to ask your provider or your nurse about the different products like the Synera patches. I've had many patients use different numbing products, and believe me, no one ever says, I wish I didn't use that. So if that is something that will help you be more comfortable in your treatment and the injections, sometimes I have people start out with them and by the end, they don't feel like they need them anymore. Others, use them from start to finish, and both are perfectly fine. But don't be afraid to use these if you think that they would be of benefit to you.
Perfect. And actually, this just popped up. Can you reuse the patch at all, or is it a one-time use only?
No, it is a one-time use patch. Mm-hmm.
Perfect. I think that was the most concise answer question you were given in terms of giving an answer. I like it. You didn't have to beat around the bush. Just had a very quick and ready answer there. So I think we're good. Oh, here you go. All right. While we're going, how much do they cost?
Ooh, that I do not know. That is something that I would ask your pharmacy.
Hey, and that is us. That's us,
That's
Mandel.
right.
Reach out
Mandel
to
can
us.
help you.
Finally, we get a question that we can. So yes, reach out and we can figure out all of that for you. We can look into insurance coverage and what the cost could be for you based on your specific circumstances. So that's a perfect opportunity to throw it back to all of us over here at Mandel's and what we can offer for you. So speaking of Kaitlyn, I want to say thank you very, very much for all of your time today and answering all of these great questions, and for providing your expertise in all that you have. Thank you to everyone out there, both whether it was in the Zoom or in the Facebook Live, all of your questions that came in. We definitely appreciate it. And we look forward to having you guys come back here every week. The goal, what we're going to do is we will be here on Monday nights at 7 p.m. Eastern. So any time you want to come in and join, you have the time. Join. We'll have nurses from across the country coming on and giving us some answers, walking you through multiple different products that you would be involved with throughout your fertility treatment process. So we appreciate all of the interaction, the live interaction. There's even some connections of people just saying hi to one another in the room, which is great. So this is a great place to connect with maybe some of your friends or your physician, your nurse, whatever it might be. Some of your other patients that may have gone through this as well. And just really gives us an opportunity to connect with one another, because that's what this is all about, is realizing that you are not alone. You are not in this alone. Many other people are out there asking a lot of the same questions as you. We noticed that by seeing the number of times that questions are asked the same question by multiple people. So never feel alone. This is a great place where you can come and have a little bit of that camaraderie and understand that this is going to be easy, and you're going to make it through, and you will be a pro at the end of all this. So go check out our Facebook page. You can go to our YouTube page as well. You can go to our homepage, which is mymandelsPharmacy.com. You can see all these videos are there. The PharmAssist program has the videos kind of carved out on all three of those different locations. And other than that, thank you very much, everybody, for your time. Thank you again, Kaitlyn. Is there anything you'd like to share before we say goodnight?
I think that covers it. Thank you all so much for tuning in, and this is a great resource. So pull it up, have it up running while you're doing these injections. It's right there for you anytime. They're archived for you. So definitely take advantage.
Perfect. Thank you again, everybody, and have a great night. We will see you next Monday, 7 p.m. Eastern, right here on the PharmAssist program, brought to you by Mandel's Clinical Pharmacy.